Jennifer. I'm going to be doing a gender-based assignment for you guys. We're going to be talking about how gender-based affects us in healthcare and how we do our jobs. I have a little skit for you guys. I hope you enjoy. Alright, welcome to Clubhouse Medical. This is an exhibit of an ER that we have, and we're targeting X-ray technologist. Alright. Okay. Hey, Dr. Daisy, how may I help you? Yes, I need to get an x-ray for Mickey, please. Mr. Mickey Smith. Okay, sure, I'll go set up the room. Hey, we have an x-ray for Mickey Smith, and we need to get the room set up. Okay, sure. Alright. And knock knock. Yes. Mr. Mickey Smith. Oh, sorry, I think I had the wrong room. Yes. Are you Mickey Smith? Yes, I am. Okay. I'm sorry. What's your birthday? March the 5th. Oh, okay. Excuse me for just a moment. Dr. Daisy, Mr. Mickey Smith is more like a Minnie Smith. Do you care to elaborate on that? Yes. So, apparently, Mr. Mickey Smith identifies as Mrs. Smith. And so, what kind of x-rays are you needing? Chest and abdomen for abdomen pain. Okay, sure. How have you ever had a patient like this before? Oh yeah, we have it all the time. All you have to do is just do the x-ray, explain to them your practices, and just respect them for what their wishes are, and explain to them that by law we have to put them down for the sex that they are, not for the gender that they wish to identify as. Okay. We'll get your x-ray for you. Thank you. Thank you, Minnie. Okay. Okay. Alright, sorry about that. Alright, if you'll come right this way for me, we'll get started. Sure. Mr. Smith? It's ma'am. Yes, I'm sorry, I understand that. Just because of our legal laws, we just have to identify you as a female in our medical records chart because of that's what we have to approach you with as far as our scans and such. And, we'll respect your wishes as being identified as female. We can call you ma'am, but we do have to practice our protection for our radiation, gonad shields, and such. If you're good with that, then we can go ahead and proceed with the exam. Fine, whatever, but I'm not getting dressed in front of. That's fine. I understand that. When we'll step behind the curtain when you get dressed. Okay, fine, whatever. Okay, all right. Well, come on through here, and we'll get you dressed. Go ahead and take that off for me, and then we'll put a gonad shield around you, around your waist, so that you're protected. Okay? There we go. I hope you're not looking at me. This is ridiculous. Can't even get this on. This is not a one-size-fits-all. Y'all are crazy. I do apologize. There we go. Okay. All right. I just need for you to come right over here for me and just kind of face that board for me. Okay. Perfect. Okay, so just take a deep breath in for me and hold your breath. And you can breathe. Okay, and I've got one more, and we're going to have to take that gonad shield off for this. That way we can see the productive organs. We'll just put it down a little bit lower to cover your... There we go. Okay, and hold your breath. You can breathe. Okay, Mrs. Smith, you can go ahead and get up and get dressed. I'm sorry. Y'all don't give anybody time to get dressed around here. Yeah, there we go. Okay, I'm sorry about that. So we'll get these reports sent over to the radiologist, and they'll get them sent over to the doctor for them to read for your report. I do apologize that if there was any kind of confusion or anything, and thank you for letting us do your x-rays today. Well, thank you for treating me with respect, and I really appreciate it. You're not going to tell anybody, are you? No, of course not. That would be violating HIPAA, and we won't be doing any of that. So, your secret's safe with me, and we'll just have to do it for our medical purposes. Yes, I understand. Yes. Okay, there's your room. Okay, Miss Smith, I hope you have a good day, and I hope you feel better. Thank you. There we go. Okay. Alright. So, sex is the difference between an X and Y chromosome and is reproductive from versus the gender, which is the role, behavior, lifestyle choices, life experiences, kind of the culture and the people that one hangs out with and identifies themselves with, where the sex is XXXY chromosome, and how reproductive organs and the hormones. So when we're talking about sex versus gender in healthcare, how it affects us is that we have medications that affects men and women differently. The main organ, other than obviously the reproductive organs that are different, is the heart. And the heart, the connective tissue on the inside of the heart is different because they have to push out more blood when they're pregnant, women do. So therefore that's going to be a little bit thicker than it is in a man's heart. So those are a few things just in medicine that is how to tell the difference between men and women. Women mostly have more body fat than men naturally, so when it comes to doing x-rays and such, we gauge those by body habitus, how much fat's on a person, what we're x-raying versus an arm, how thick a body part is, and how much radiation to give somebody. There are newer technologies out that will, you can select a man or woman on there, and for CT scans, they do less radiation in the breast area. It goes down to about 20% irradiation for that breast region versus your normal radiation around the rest of the body. So it's smart technology to do so. So being able to determine, okay, this patient is a female versus this patient is a male is very important. I do believe that we do and should have more training in the workplace about transgenders and ways that people identify themselves, because we don't have that, and we are often caught off guard on what a patient is and how they identify themselves, or going into a room just like we did and looking for Mr. Smith and seeing someone else, and we're thinking, okay, we're in the wrong room. and then we're thinking, okay, we had the wrong patient, wrong identification, something like that. And so it would be a nice thing to do, even if it's just an annual computer monologue where you go in, you kind of go through some slides, because a lot of people don't know how to react to those things. Also, research in medicines. There's a lot of FDA drugs and researches that they do research on men and not women, because of women in childbearing ages. They don't want to see anybody be affected by the fact of ruining the ovaries or any chances of being able to give birth. So they exclude women from these trials. For instance, Ambien was not tested on women before it was released to the public, and most women, they process their drugs faster than men, and whereas men, they take it, they go to sleep fine, they sleep through the night. Women can take it and sleepwalk, sleep drive, sleep swim, do things like that put their life at risk. So now they're doing more researches where women are involved in those medications before the FDA approves them to be released to the public. So those are some very good beneficial things that they are doing to protect men and women in the forefront of things in healthcare. And then we are taught to give every patient dignity and respect, and we continue to do so with everyday change in society and however one person decides to identify themselves. So I had a good time doing this project, and I hope you enjoyed the video. Thank you.